Dr. Manish Baheti, all of them. Right. Dr. Patwardhan to
And then that person went, and one after the other, she trained everyone. Then next came sonography. For sonography also, she made so many arrangements at her clinic also, and then we all one by one, first she went, then one by one we went to Vadia and we learned. So that whosoever comes at any time of the day, that everyone knows what is to be done. So she was such a good person. And she was very good to me, of course, very much. I have been ill so many times, very serious also, and I sometimes I lost my senses also. That time also she took lot of care of me. Not only that, even when after laparoscopy, IV sonography, then she thought it was mandatory for the IVF patients. Then she went to Melbourne, then she, not Melbourne, Bonal, then she went to other places also, and she trained one by one everyone in that subject. And this is how we are here today to speak of her. And she was a gem of a person. She was not only updated in her subject, but she had lot many subjects. She learned, she used to read English literature, Hindi, Marathi, Sanskrit, and she also used to like to go for Natya Sangeet. She took me sometimes for Natya Sangeet and for some Hindi drama, Marathi dramas. And she used to tell me everything. You understand what she's saying? I said, yes, yes. I learned a lot of Marathi. She used to correct me in small, small things. And this is how I owe to her. I still owe to her. I'm working with her today. She was a gem of a person. And although she is gone, all the memories are very alive.
Rates in patients based on their age. And you can see that as the woman grows older, if you don't test the embryos, the light green bar, the pregnancy rates drop dramatically. But if you test the embryos, the pregnancy rates are significantly better. So when the incidence of abnormality in the oocytes increase with advanced maternal age, this is where it is likely to help. Again, another study, if you look at in young patients, the difference in the live birth rates or ongoing pregnancy rates are not significant, but in elder women, this difference is very significant. So yes, it does help women who are older because the incidence of abnormalities is higher. But the bigger question is, does it do any harm then? If it does not do any harm, why not offer it to every patient? And this is the STAR trial which shows that there is a possibility of an embryo loss rate of as high as 40.
Ongoing. Sometimes we are a little better, sometimes we are not so good. We have been trying and we continue to try. And we struggle to maintain once we come to, okay, we have got a good number, our incidence has reduced, the next year we go up immediately. We have been really struggling. I'm going to start with one woman who arrived when I was on duty. It was on a Diwali day. One of the worst referrals you will get on Diwali day, okay? Because all the institutions shut off and they travel and come. And she was an IVF pregnancy, triplets. She had fever and then she had breathlessness. She was admitted in the hospital, complained of pain abdomen, and was given a concoction of medications. She became more breathless and she was referred out to us, and she was actually coughing out blood when she came. When we intubated her, her tubes were just filled with this frothy florid pulmonary edema. Okay, we lost her. We lost her in a short time. But if you take a look at this woman's story, if you just look, give 2 minutes of your time, what would have been the story when she started her journey? Would have been her story when she came to the IVF center saying that I want to become pregnant, and somehow we seem to have failed her. That red flag would have been anywhere. Okay, I've put down from the time she started pre-pregnancy to the time of referral into our institution. It could have been anywhere. Maternal deaths as a quality indicator are not very good, okay? They don't help the woman or the family. You don't get that woman back. How can they be of help They may help another woman that walks in, but absolutely useless when you talk about that woman or their family, that the entire person. So can we put it at somewhere else? What is actually a red flag? Red flag is something that tells you that don't go ahead. Okay, it is a danger sign. If you go ahead, you may not survive, and that's the kind of a red flag we are talking about. This is not a good thing to move forward, and this moving forward can mean stop. Okay, she is not well, you have to do something for her so that she becomes back normal, or sometimes it might be you need to terminate this pregnancy for her to be alive. So it can be a spectrum. Now when we look at healthy women, these healthy women sometimes have a complication, sometimes life threatening, and if you don't manage well, they have a maternal death. The best time to put a red flag would be at life threatening stage, and that's the time that would be most ideal.